Well, hello and welcome to Ask the Doctor. My name's Jerry McGee and I'll be your host for today's show. We're here with Dr. Eugene Goldberg of Wellness Associates. Dr. Goldberg, thanks for being with us today.
Thank you for having me.
We're excited to be here today. We're talking about a very common problem out there, carpal tunnel syndrome.
Correct.
A lot of people have dealt with it, whether it be a work-related, repetitive problem, or just something that that has just started for them. But I really wanted to kind of talk today, Doc, about how chiropractic care can take a conservative approach versus a surgical approach. I know a lot of people would rather kind of exhaust every conservative approach before they go under the knife. Because, I know some people personally who have had non-successful carpal tunnel surgery.
That is sad.
Right? So I don't think it's a cure-all or a definite fix for that problem isolating right here. So tell me a little bit about your philosophy on carpal tunnel and what we can do to help that person.
So we don't want to put the cart before the horse. We want to try to help you if we can conservatively find out the root cause of why you have the carpal tunnel. A lot of times people don't realize this, Jerry, it's coming from the neck. So maybe it isn't carpal tunnel, it's carpal-neckel. Okay?
Get that. We might have a new phrase here. We're going to coin it today.
Which is a pinched nerve in the neck. The brachial plexus, which is a network of nerves in your neck, controls the upper extremity. So if you're having pain, pins and needles, numbness, or burning in the hand or the wrist, it could be coming from the wrist. Of course, we can address that by adjusting the wrist. Okay? It could be coming from your wing bone, which is your scapula, which affects the shoulder, the elbow, the wrist. It could be coming from a pinched nerve in your neck, which of course is the brachial plexus. And of course the network of nerves in your neck controls the kinetic chain into the wrist. So we want to get to the cause of why you have it and hopefully correct it. I've had people that have canceled their surgeries after 3 weeks of conservative care, where they were 40, 50, 60% better, or they said, hey, this is helping, I'm tremendously better, I don't think I'm going to have the surgery. So that makes sense to me, Jerry, is to do conservative first, exhaust that. If that doesn't work, then God bless you. Have the surgery.
So I'm sure there have been some times, because what I like about what you do here, right, is that you're not afraid to say, okay, maybe you do, maybe the surgery will be okay for you. We've tried this for 3-4 weeks, had some improvement, but the person still wants to go ahead with that. You're okay with that. That to me, in this whole health arena, is something that is we've lost.
I understand.
Okay, and I really appreciate that with what you guys do down here, because I think if everybody in the healthcare arena worked together, as a patient, our care would be that much better.
Well, you benefit then.
Right.
You're getting the best care.
Exactly. That's that's my little soapbox on healthcare. But now, when we're looking at this concept of carpal tunnel, I know a lot of people might be relating to this purely from say a work-related problem. Okay, where the ergonomics of their workstation maybe aren't that great. They might not understand that ergonomics is positioning, and as you had just brought up about the neck and the shoulders and everything, most of the time they really say it's with a mouse and maybe with a keyboard. But have you found that a lot of times even the positioning of the head, the shoulders being slumped forward while they're working, there's a lot more ergonomically involved with this than just the wrist.
It's a whole science, Jerry. It's better body mechanics in the workplace. Get an ergonomically designed keyboard. Watch your repetitive stress. Take breaks. Keep your spine straight. Keep your spine aligned. That your nervous system controls your cells, your organs, and your muscles. So if you're not straight, then you're going to pinch on the nervous system, which is going to affect the kinetic chain into the upper extremity, into the wrist. So you have to watch for certain things. Make certain changes in your life. Get an ergonomically designed keyboard. Okay? So there's a lot of things the patient can do from their standpoint to make changes in their workplace. You spend a third of your life doing it.
Right.
It's a syndrome. It's called repetitive stress syndrome.
And a lot of times also I see people that are in the workplace have these repetitive problems. The first thing they're going to do is slap one of those wrist braces on.
Correct.
Right? What's your philosophy on those wrist braces?
There's pros and cons. To me, it's a temporary crutch. The key word is temporary. Okay, you don't want to use that long term, because what will happen is you'll become dependent on it, you become addicted to it. What it'll cause your body to do is it'll cause your muscles to actually atrophy because you're not using them. Okay, I don't think God designed us to have a wrist support around our wrists every day, all the time. So once you make some positive rehabilitative changes in your spine, in your wrist, make certain changes at work, then you can throw it away. You don't want to use that the rest of your life because there's going to be side effects from that. It's a crutch. Just like a crutch is like anything. You want to get rid of it because your muscles are going to atrophy.
And the interesting thing, as I say on every show really, is I'm amazed at how when we've got this problem right here, right, the traditional approach is everything is focused on that one area, and that's it. So surgery is, you know, to release this area. There's no looking up the extremity, up the shoulder, into the very few.
That's sad to me, Jerry, but I don't know if you know this, but they actually banned carpal tunnel surgery in Europe. Why? And I'll give you the statistics. It's a good thing you're sitting down. 90% of the time it doesn't work anyhow, because I get people that have had unsuccessful surgery, like you mentioned earlier, and then they say, well, fix me. You know, it's 10 times harder to fix somebody post-operatively who's had unsuccessful surgery than treating fresh before they have the surgery. That makes sense to me. Don't put the cart before the horse.
Mm-hmm. Yeah, I think too many times we allow our health to be dictated by other people, and really I think if you've been out there and if you've been diagnosed with carpal tunnel, scheduled for surgery, maybe you haven't looked at any other alternatives. You know, now is the time to pick up the phone, call in here to the office, come down, take a look at it. Like you said before, if you look at a typical treatment program of a person maybe seeing a benefit of 40 to 60% in just 2 to 3 weeks, I think that's well worth postponing, you know, a surgery and allow a conservative approach to come in and possibly take care of this problem.
It's called a second opinion. Before you have surgery, you want to get a second opinion. What we do differently is we give you a conservative second opinion.
Right.
Okay, we're not going to recommend surgery. If you get another surgical opinion, they're going to say surgery. We're going to say, let's hold off on the surgery. Let's give you a second opinion, but it's a conservative second opinion. And if we can help you, great. If not, then God bless you.
Right.
Go have the surgery. You have my blessing.
And again, as I mention all the time, one of the great things here at Wellness Associates is if somebody's watching this right now, dealing with carpal tunnel, just wants to come down, kind of get an evaluation and learn about chiropractic care and what you can potentially do to help them, pick up the phone, call the girls. They'll set you up on a program here where you can come in and have a free new patient evaluation, get to meet Dr. Goldberg, let him explain his conservative approach to this, and I think we would all agree that it's worth 2 to 3 weeks of our time to avoid getting any type of surgical procedure and seeing if this isn't something that could make a big difference for them. So I'm excited about always on these shows bringing that alternative approach to things. And like you said, not going to another surgeon. Go to a different type of health practitioner.
Conservative.
Right. Let's look at another form, because there's a lot of great forms of healthcare out there and ways that our viewers can help themselves.
I'll just tell you one thing, and people don't realize there's a nutritional component to this. I don't know if you've ever heard this, but people who are deficient in B6, B12, okay, that can affect carpal tunnel. So you put them on B6 and B12. If that's the answer, then surgery is not going to help that because they're still deficient in B6, B12.
Right.
So if you get on B6 and B12 and you get rid of the carpal tunnel, the good news, Jerry, is you don't need the surgery.
Yeah. There's a lot of reasons why you need to take a look at some conservative approaches and exhaust them all prior to going in and having things done from a surgical standpoint. So we hope you found this show to be kind of educational. If you're struggling with carpal tunnel right now, there are alternatives. There are other things that you can take a look at. Pick up the phone, give Wellness Associates and Dr. Goldberg a call. Come on down, learn a lot more about how chiropractic care can impact your life and your specific risk problem that you're having. And like he said, it could very well be coming from a neck, a shoulder. There's a lot of things that he'll look at this total approach. So again, Doc, thank you very much for this info. I think that was some great material for our people, and we hope you enjoyed this show, and we look forward to seeing you on the next episode of Ask the Doctor.